Welcome to The Explainer. We're here to break down complex research into presentations that are clear, dynamic, and hopefully really interesting. Today, we're diving into idiopathic generalized epilepsy, or IGE.
So, if you've heard about IGE, you've probably heard things like this. The diagnosis is simple, the seizures are easy to get under control, kids just grow out of it. For decades, this has been the common wisdom, painting a picture of IGE as a pretty mild, manageable condition. But, as it turns out, emerging evidence is telling a very, very different story.
So, what's really going on with IGE? Let's dig in and start separating the long-held myths from the current reality.
First off, let's just get a sense of scale. IGE isn't some rare, obscure condition. It makes up about 1/5, a full 20% of all epilepsy cases. We're talking about a significant number of people.
And yet, look at this. It accounts for less than 1% of all epilepsy research. So why the huge gap? Well, it comes right back to those misconceptions we just talked about. The dangerous idea that IGE is benign and basically a solved problem. As we're about to see, nothing could be further from the truth.
So, first up, let's bust that myth about diagnosis being simple by taking a look at what IGE actually is, because it's not just one thing.
The key diagnostic sign, the thing neurologists are looking for in an EEG, is something called a generalized spike wave discharge. The best way to think about it is like a sudden, synchronized electrical storm that happens across both sides of the brain at the exact same time. That's the hallmark of these types of seizures.
And that electrical storm shows up clinically in three main ways. You've got absent seizures, which look like staring spells, where a person just checks out for a few seconds. Then there are myoclonic seizures, these quick, sudden muscle jerks. And finally, generalized tonic-clonic seizures, which are the full-body convulsions most people picture when they think of epilepsy.
Now here's where it gets really interesting. IGE isn't one condition, it's a whole spectrum of syndromes. Look at how they break down. Childhood absence epilepsy usually starts between ages 4 and 10 and is all about those staring spells. But then you have something like juvenile myoclonic epilepsy, or JME, which hits in the teen years and is characterized by those muscle jerks when waking up. Each one is different, and understanding which is absolutely crucial.
And this just shows you how complex it can get. Sometimes the EEG patterns can actually fool you. They might look like they're starting in just one area of the brain, leading a doctor to diagnose focal epilepsy instead of generalized. This is a huge deal because a misdiagnosis can lead to the wrong treatment, which doesn't help and can sometimes even make things worse.
Okay, let's move on to the genetics of it all and tackle another misconception, the idea that there's just one simple genetic cause.
Now there's absolutely no doubt that IGE has a strong genetic link. I mean, check this out. In studies of identical twins, we see a 76% concordance rate. That means if one twin has IGE, there's a more than 3 in 4 chance the other one will too. That's a pretty powerful indicator that genes are at play.
But it's not that straightforward. In a few rare cases, sure, it might be tied to a single high-impact gene. But for most people, it's what we call complex inheritance. The thinking is that it's caused by a whole bunch of different genes working together. But for now, we just haven't figured out the exact combination for most people.
So the bottom line is, for the vast majority of people with IGE, doing a genetic test isn't going to give you a nice, clean answer. The science just isn't there yet, which is exactly why this is such an important area for more research.
Now let's get to what might be the biggest myth of them all, the idea that IGE seizures are easily controlled.
Let this number sink in. For juvenile myoclonic epilepsy, one of the most common IGEs, nearly a third of patients have seizures that are drug-resistant. That means they keep having seizures even after trying different medications. That doesn't sound easily controlled, does it?
And you know, it's not just about the medicine. Lifestyle plays a massive role here. Forgetting to take your meds, not getting enough sleep, stress, even some simple over-the-counter drugs can trigger a seizure. It makes management a real daily challenge, especially when you're a teenager or a young adult just trying to live your life. So, because of all this complexity, treatment usually follows a kind of step-by-step process. You start with counseling on triggers and trying first-line meds. If those don't quite cut it, you move on to some alternative medications. And for those really tough, drug-resistant cases, you move into more advanced therapies.
And this is where there's some real reason for hope. For those people who have the most difficult to control seizures, there are new therapies coming out, like neuromodulation devices that stimulate nerves to calm the brain, and even specialized dietary therapies. These are providing new avenues for people who thought they'd run out of options.
All right, let's tie all of this together and talk about why understanding the true complexity of IgE is so incredibly important. You know, this quote from the research paper really says it all. It calls IgE an understudied spectrum and says that our understanding and our therapies remain inadequate. Inadequate. That's a pretty sobering assessment.
So let's be crystal clear. This is not a benign condition. People with IgE deal with psychiatric issues at rates similar to other types of epilepsy. The risk of sudden unexpected death in epilepsy, or SUDEP, is also similar. The idea that this is some kind of mild epilepsy just isn't true. And frankly, it's a dangerous way to think about it.
And that leaves us with one of the biggest unanswered questions in the field. Why do some people seem to outgrow their epilepsy while so many others don't? Cracking that code could be a total game changer. It's a huge question, and it really highlights the urgent need for more research to finally unlock the secrets of IgE.